Good morning, everyone, and welcome. We'll go ahead and get started. Thank you all for joining us. I just want to introduce myself. My name is Brad Dolan. I'm the Human Research Protections Program Director here at the HSC. So our office is the Human Research Protections Office, or HRPO as we call it. We're the administrative arm of the IRBs here at the HSC. Research University is an annual conference hosted by our office with generous support from the Office of Research and the Public Responsibility in Medicine and Research, also known as PRIM&R. We're excited to share with you an incredible conference program featuring distinguished speakers from right here at UNM, as well as national experts representing PRIM&R. We've got the National Association for Biomedical Research. We have the Navajo Nation Human Research Review Board. We have HRP Consulting Group, the Association for Assessment and Accreditation of Laboratory Animal Care International, and the Association for the Accreditation of Human Research Protections Programs. We have speakers giving talks both in person and remotely, and they'll all be broadcast here in the auditorium and on Zoom. So this is the first year where Research University has spanned 2 days, and we've advertised it regionally. Regionally throughout the Southwest. So we especially want to thank anyone who is not affiliated with UNM for attending. We have almost 400 registrants for this conference and from representing 90 different institutions. And it's across the entire Southwest. So if you're here visiting Albuquerque, it's a wonderful time to be here. The weather's nice, the trees are turning yellow, and the sky is filled with balloons. So just some logistic information. You'll find a brochure with a schedule at the full schedule of events at the check-in desk. So that'll guide you as to what talks are being given. Also, you'll find a QR code on there for questions. So basically, just scan the QR code. You can input any questions there, and then at the end of the speaker's session, the questions will come to me, and time permitting, I will ask the speaker a selection of those questions. So I wanted to begin by thanking our staff at the Human Research Protections Office who make this possible. They are the backbone of our Human Research Protections Program. So I wanted to thank, we have Carlos Enrique Ibarra. We have Cheyenne Castillo, Tanya Silva, Kevin Tenorio, Rafael Averic, Gracie Alvarez, Christina Gallegos, and Josh Smith. And I especially want to thank Ernestine Armijo, our Education and Outreach Manager, who is the mastermind behind this event every year. And she's the one you want to contact if you have any questions about your research or how to get it through the IRB process. She can absolutely help you with that, or anybody in the office can help you with that. So, and with that said, we are so grateful that you're here and here to hear our talks and be a part of this event. So now I would like to introduce our keynote speaker, Dr. Ivy Tillman. She's the Executive Director of Public Responsibility in Medicine and Research, also known as PRIM&R. Dr. Tillman is a passionate, multifaceted educator, bringing more than 18 years of leadership in research ethics and oversight to her role at PRIM&R. Dr. Tillman has a long history of advocating for research ethics with various organizations, including PRIM&R, the Consortium to Advance Effective Research Ethics and Oversight, and the Association for the Accreditation of Human Research Protections Programs, or AHAR. Today, Dr. Tillman will be presenting on charting the path forward, ethics, trust, and community and research. So please join me in welcoming Dr. Tillman.
All righty, thank you. Can you all hear me? Okay, I'm gonna get set up and then we'll get started. Thank you for that warm introduction, and I'm really excited to be here in New Mexico. If you can't tell from my accent, I'm from the southeastern part of the country. And the more that I talk, the more you'll hear it come out. So this is my first time in New Mexico. I've been to the Southwest several times, but I think I came at just the right time because I was greeted by the balloons this morning, which were simply just amazing and lovely. So thank you for your hospitality and thank you for doing this particular event, Research University. And I'll get started. My keynote is not just a keynote where I'm talking. This is a conversation. I want to make sure y'all can hear me. And as we move through this conversation, I'm going to be asking questions. And I not only welcome, I need your participation. So we'll talk about community and cultures and so forth. The community that I come from, we do a lot of open dialogue and we do a lot of participation. So if I ask for your participation, if you can please help me out by participating along with me. And this is really a conversation about how we move forward. I don't know about you, but within this past year, we've been contemplating the path forward at PRIM&R, the path forward for research and communities and all of the things that we hold near and dear, ethics and inclusion and so forth. And there is a path forward. There's a path forward together. My disclaimer is I'm of the age now where I have to wear glasses, so you'll see me put them on and off, but please bear with me. And so once again, I want to thank you for this opportunity to be here. Given our current environment, some of the shifting and federal policies, our research landscape looks different. But it's really important that we, as research ethics professionals, oversight professionals, researchers, and the public are here today to connect, to communicate, and to collaborate even more. So just by a show of hands, I want to understand everyone who's here and how we all fit together. How many researchers or faculty are here? Wonderful. Thank you for being here. Oversight professionals, those wonderful. Thank you. Members of the public, anybody from what we would consider the public? Thank you. We see you. My background, and thank you for the introduction. My background is one in which I've worked with all of our groups that are represented. I spent the past, I'm dating myself now, about 21 years in research ethics in the IRB offices at Augusta University, which is in Augusta, Georgia. A lot of people don't know where Augusta is. Augusta is about 2 hours south of Atlanta, home of the Masters golf tournament, but also the home of James Brown, just in case you didn't know that. And I spent time starting as a research coordinator. So my background is in pediatric sickle cell research. And I was working on studies to prevent stroke in this population, which is really important. The lessons that I learned there around how we communicate ethics and how we communicate about our studies to the public have formed where we are here. Additionally, I spent some time at the Mayo Clinic doing similar work in IRB offices and the IRB office. But I'm most passionate about these types of conversations that we're going to have today. So glasses back on. I also want to thank the University of New Mexico, particularly Ernestine, working very closely with our team at PRIM&R. This is an amazing, stellar event, Research University. And in the past, we've supported, but I really like this model. I like the model of having the researchers in the room, having the faculty here, having those who are the oversight professionals and the public having these conversations. Coming from my IRB background of over 20 years, I know that it is essential to have a partnership and a collaboration with researchers and our oversight professionals to move the science forward. I've seen many different models, but the one that works the best is when we are working together and we are united. And so I look forward to seeing more of that and having those types of conversations. But before we begin, I want to take a minute as we're gathered here in Albuquerque on the homelands of the Tiwa and Pueblo peoples, sovereign nations with deep histories and a living presence that continues to shape this region. Research ethics has a vital role to play in strengthening relationships with Indigenous communities. And today we have the opportunity to honor sovereignty as central to research, to deepen our understandings of each other, and to reflect on the steps each of us can take to build more respectful relationships. I don't know how many of you are familiar with PRIM&R. If you can just raise, and you're not going to hurt my feelings if you're not, but if you could raise your hands and let me know if you've heard of PRIM&R. Okay, I see one hand that really knows as well. PRIM&R stands for Public Responsibility in Medicine and Research. And the first word in that, the first word in that name, public, is really important to us. PRIM&R is a nonprofit organization, and we've existed for over 51 years. We are here to advance the highest ethical standards in research. We exist to support, to educate, and to convene our amazing PRIM&R community and the public to advance ethical standards in science and research. We do that through many different ways, but we're here to serve this community: oversight professionals, ethicists, researchers, research staff, study coordinators, and the public. And we've been expanding our connections with stakeholder groups to provide opportunities. There are many ways that people can interact with PRIM&R and our work through our education programs that span from the beginning of careers to those who are well advanced in their careers, to those who are leaders, research enterprise leaders, as well as certifications. We offer certifications in human research protections, our certified IRB professional, as well as animal protections. Our CEPIA certifications are also great tools. We have a growing community of over about 3,200 members, and our members are who sustain and support us through community building. We have fora that are available online, we have roundtables, and we convene our communities to have these types of conversations. And more recently, we've moved into public policy initiatives and spaces that honestly, I did not see myself doing when I began at PRIM&R, actually 2 years ago this month. But the times call for it. And it calls for us to advocate and educate on behalf of you, the community, of professionals, of researchers, and of the public. And I just want to spend some time kind of sharing some of what we've learned in the past, really, y'all, it's been 10 months. That we've been doing this work. It feels like about 2 years, but really 10 months, and it's gone by very quickly. I was sharing earlier this morning some of the lessons that we've learned by visiting the Hill were that not enough people know that you exist. There are not enough people that know about the essential nature of research oversight and research ethics that ensures public health and safety continues. And so we were actually meeting, myself and a colleague at PRIM&R, we've been meeting with federal agencies. We've been meeting with Senate staffers, health policy staffers, to have these types of discussions to ensure that as federal policy and priorities shift, that the research, ethics, and oversight ecosystem is not destabilized, that it's strengthened, that people understand the need to have a strong ecosystem that radiates beyond just the Hill. It impacts everyday life of Americans. And at PRIM&R, I just want to bring up our values. These are our values, and sometimes I know you're wondering, like, why are you talking about your values? This is an academic type conversation, but our values undergird everything that we do. Our values guide the work that we do, they guide the programs that we develop, and they guide the communities that we serve. And as we consider trust in science and research in our present environment at PRIM&R, we believe that everyone must have fair and equitable access to the benefits of science. We are connecting our vision and our values together to ensure that we increase our impact. And so I have to giggle because I sent Ernestine an email and said, the title of my keynote has changed and I don't know what to do. And she's like, don't worry about it. They don't care about the title. They just want to hear from you. So I'm like, okay, good, cool. So my initial title was Chartering the Path Forward. And when you think of chartering, of course, I think of myself being on a nice boat and we're chartering our path out there, right, into sometimes unknown waters. And that's kind of where we are right now. But with that chartering, I really want to ground it in charting the path forward. Charting feels like action to me. It feels like actionable results, practical application to ensure that we are increasing public trust in research. I found this quote about a couple of months ago, and I think it just grounds our conversations and what we're doing. Trust is that relational glue. It binds us, those of us who are in science, with the public and advancing the social goals for public health, and it's essential. And as I've considered the focus of today's conversation, it was really important that we ground this time together in this quote as we move forward. Given our present realities and what we would call like the state of trust in science and research in our country, it's imperative that we have these conversations with everyone, with you doing the work, with those who are benefiting from the work, with those who wish to advance the work, to ensure that science remains a trustworthy endeavor. I felt it was important to elevate our discussions around increasing our impact, connecting the public and the research enterprise together to chart our path forward. Oftentimes, though, when we have these types of conversations around trust, what is the first question that you may ask yourself? Anyone? If you say it out loud, I'll repeat it so those who are with us remotely can hear. When you think of trust, what's one of the first questions that you ask? How to establish it? Very good. Anyone else? Mutuality, absolutely. Okay, so y'all already saw my slides, and so we can go home now. No. Mutuality, and that's the goal. But getting there sometimes feels like we are on those uncharted territories and out there on the waves. You know, I've been in these spaces for a long time, and oftentimes, as a member of a marginalized population, I'll get the question, why don't you trust research? Why don't you trust science? And the framing of that centers that whole responsibility on the individual and the group instead of the mutuality that needs to occur when we consider trust. And so I'm going to spend some time just talking about the state of trust and what it looks like. How can we connect the public to the critical value of the scientific process and the benefits of supporting research? So before I was in research, I was a high school biology teacher. And I smile when I say it because that's where I got all my scars and I was able to move forward. But I taught biology because I have a degree in biology and I absolutely love it. And I remember teaching my students the scientific process, right? And somewhere between when we're teaching it, the scientific process in our K through 12 settings, and when individuals become adults, they lose a lot of that understanding of what science looks like and the processes that occur, which is why we're seeing a lot of what we're seeing in the public now. But how can we help the public? How can we mutually work together so that they understand and acknowledge and agree with the benefits of supporting research? And when I thought about the word support, support does not necessarily mean immediately participating in a research study. And I heard that loud and clear from some of the community conversations I've had. Support looks like a developed, shared commitment to interrogating the facts in a manner that moves the discourse forward and doesn't contribute to misinformation. So communities can support research while we are developing it, while we're developing these relationships without automatically having to participate. And oftentimes when I'm out in the public, when I'm out having conversations in community forums, at health fairs, in different settings, they, meaning they, the public that I'm speaking with, the different groups, they're saying every time I see a researcher or every time we have a conversation, someone's wanting me to enroll in a study. And so I back them up and I say, that's not what I'm here for. We're here to have this conversation about the importance of science and research and what it means, about the protections that are available for you, empowering you to make the best informed decision for yourself, but to also support others in making said decisions. But I want us to explore what it looks like for the community to support research and for the research enterprise to support the community, that sustainable, mutually beneficial relationship. And when we take a minute, I did some research on if I had to write an essay on the state of public trust in research. So I went to the Pew Research Center, right? And I wanted to find out, where do we stand? Because we know trust is crucial to advancing science and public health. And we become challenged in advancing science and public health without the trust of the public. Surprisingly, according to Pew, 70% of more Americans say they have confidence in scientists to act in the public's best interest. That was so encouraging. That's far higher than the levels of trust that we see in other prominent groups, like elected officials, journalists, or even business leaders. But we also recognize that science and scientists have taken a hit after the pandemic in areas of misinformation and polarization. Our country's understanding of science has shifted to a place where scientific conclusions are viewed through a polarized lens oftentimes, instead of one that's grounded in objectivity. By definition, research is designed to contribute to generalizable knowledge, that information. However, what's happening oftentimes is that the credibility and nature of said generalizable information is based upon sources that now play a growing role in shaping how the public perceives and accepts scientific conclusions, with significant implications for trust in science and medicine. And we may want to spend some time examining why this is the case. Often, when we center those generalized conclusions and that generalized knowledge within the walls and the language of academia, we lose people. We know that trust is necessary for the successful dissemination and acceptance of the knowledge gained, and without it, we could achieve very few of our goals, and we would know very little. But I've spent some time, particularly earlier in this year, understanding that positionality and understanding when we say, why don't you trust? Or how can you trust more? We often don't talk about how trust comes with a burden. We often place the cognitive burden on the public to deem us in science as trustworthy, to do their own fact gathering, analysis, and risk assessment, and to insist, as some science communicators do, that science is still trustworthy, places a great burden on the public to assess each case for themselves. And placing that onus solely on the public involves degrees of risk for them that we often don't consider because we are very much entrenched and we're in it. There's a vulnerability and risk associated with trust. So when we say trust science, sometimes we ignore the vulnerability and the risk associated with trusting. And when we begin to consider trust in marginalized populations, understanding that vulnerability and risk can help us begin to answer some of the questions around why mistrust persists. Trust only from our framework to them is also centered as one directional. And we know that trust involves building relationships and is not a one-time encounter or occurrence. And it's solely not an individual decision. I talked about the community that I come from. In the community that I grew up in, decisions about your healthcare, decisions about your education, decisions about many of your life choices were made in group, in family, right? And so trust is also not solely an individual decision. Often trust and mistrust are based on collective and group understandings and acceptance of what's deemed to be trustworthy. So as we move forward, I want us to consider a reframe of our focus from just solely expecting the public to trust to using the ethical frameworks that undergird everything we do and are foundational to our work to center trustworthiness and to extend this into the community. And so we begin with ethics, because that's my favorite topic. How does the practice of research ethics contribute to advancing trustworthiness? Does anybody have any thoughts? I know this is a heady question. I've sat with this question for 6 months, so I'm not expecting you to know immediately, right? But I want you to begin to think about it. The research ethics frameworks that we use. I come primarily from human research ethics. So those three, right, from the Belmont and others, How does that contribute to advancing trustworthiness? Or how are we articulating it to ensure that the work that's being done advances trustworthiness? Something for you to think about. We know and we quote several of our ethical frameworks, but how often are these principles and said frameworks articulated in the public discourse when we discuss science and research? Ethics undergirds who we are, what we do, and how we do it, and how we advance trustworthiness. But I'm going to ask you some questions. And these are questions that I've been asking myself. Does the public know that you exist and that protections are in place? How do you explain what you do to your family? Is it hard? Yeah, it can be challenging sometimes. At PRIM&R, we're working on some ways to communicate around science and oversight to help you. Because I've had these conversations. I have 4 boys, and so my boys know what IRBs are and they know what ethics is. But outside of that, it's really hard sometimes to explain who we are and what we do. But it's important now more than ever for us to do that and to be in the public discourse. Is the public aware of the essential role of researchers in the context of oversight and protections? Researchers in partnership with IACUCs and IRBs. Do they know that that exists, right? Do we consider additional frameworks beyond the ones that we know and that we rely upon? The ethics of community, the ethics of transparency, frameworks that are both applicable and appropriate to the communities that we are serving. Just some things to get you going. Nothing like these brain exercises in the morning to get you thinking. I hope you've had your coffee. I already had mine if you can't tell. And so it's about co-constructing and building this community of trust together. And I consider this, well, actually, this is a question for you. I'm going to pause here. I want us to talk about some of the challenges and trust that you see are continuing to occur. Does anybody have any examples or any insights or perspectives on some challenges associated with trust that you see continuing to occur? Yes, sir. Reproducibility. Yeah, can you expand on it a bit?
There's been some work done by scientists themselves within the science that calls into question some of the reproducibility of certain studies, and that tends to undermine the trust of science.
Absolutely. Did y'all hear what he said? Yeah, and so we're going to talk about ways that with transparency, we can talk about those challenges and how we talk about them in the public discourse so that there's better understanding of the process, right? And the need for reproducibility. Anyone else? Are there any of you who are working with communities in your research? Have you noticed, has trust increased? If it has, how? What were some of the tools that were used? Or have you seen consistent questions or concerns from the community? We'll keep talking. Oh, yes. Okay, here we go. Did y'all hear him? Miss and disinformation remain a challenge. And while the benefits of emerging technologies are amazing, oftentimes I find myself having to go back and fact check and go back to the source and make sure that I know what I know and where it comes from as a credible source. But misinformation and disinformation continue to persist. You know, during the pandemic, and this is kind of where I began to form my platform. I'm not running for office, so don't worry about that. But my platform around, you know, how do I educate and how do I empower my community on the benefits of research? And what I found was during the pandemic, there was still so much misinformation about research and about protections or the lack thereof. And so that's also an area where trust continues to be a challenge. I think someone else had their hand up as well.
There's a challenge and trust of like a lot of people think about that like they're being tricked with control. So that's a large area.
People feel like they're being tricked with placebo-controlled studies. Once again, understanding the process But those are hard conversations, right? And I don't know about you, but oftentimes when I'm not prepared or when I haven't like done that work myself, when I'm faced with one of those hard conversations, I always don't do the best explaining it, right? And then that leads to even more mistrust. And I think there's another couple of hands. Mhm. Thank you. Yeah, federal funding and the cost associated with doing research and science, quality science. When we were on the Hill in May, we had those conversations around indirects. And I was really clear, it's not overhead. It is the cost associated with actually doing quality research to ensure public health and safety. But oftentimes, when the public is not educated appropriately about the process, about the infrastructure, there's still some misinformation that persists. Someone else, I think you had your hand up.
I try to make sure that the parents understand if at any point in time your child is not responding well, you're gonna ditch whatever and talk about what arm they're in, ditch whatever the study drug is, give them the open label medication to ensure they're getting the absolute best treatment that they need. So parents know, even though your child has said, we're looking out for their best.
That's a great conversation that you're having. And it hits at the heart of that consent process, which is not that one time, it is that ongoing conversation. And those are the types of activities that build the most trust. That one-on-one, thank you for bringing up parents and pediatric studies, because those are near and dear to my heart. But having those one-on-one conversations with participants and their families and doing what you say you're going to do, right? And being transparent with them. Get back to my notes. Let's see. So when we think of trust and trustworthiness, for me, it's not a chicken or the egg kind of conversation. Which should come first, trust or trustworthiness? We need to be centering trustworthiness. And by definition, trust, and we've talked about trust a lot, but by definition, trust puts the onus is on the source of confidence, while trustworthiness requires that we become worthy of said confidence. And that's what we're going to spend some time talking about now. Trustworthiness requires us to develop strategies that connect the value and importance of the science to communicate and to collaborate with the public and the communities. It is that mutually beneficial action. It's done in many different ways. There's so much out there that you can read on it. I've narrowed it down here for the focus of this discussion, but I want you to explore all types of ways. But it's done through connection and transparency, saying who we are, what we know, what we don't know, or how we know what we know. As oversight professionals, leading public engagement around who we are, what we do, how we connect with scientists, how it is a partnership with researchers in the best interest of public health and safety. I've been in situations before in my previous times in IRB offices where a patient needed a research treatment to assist with their care. And the researcher was quite frustrated because of a process that was occurring in our office that meant that that patient that day wasn't able to necessarily access the treatment. That hurt my heart. We were able to have a conversation with the patient and their family to walk them through the steps that we were doing with the researcher to ensure said research study was available to them. That takes a lot of maturity. I can't say that when I began in the IRB office, I was there, but I began to understand the ramifications for patients and their families of partnering with our scientists and our researchers to ensure it's available. And like we talked about before, that transparency around, reproducibility, the transparency around when things don't go the way that we think they would go, the dissemination of information and why that's important. But explaining how we do what we do, explaining your work to your family, your friends, and your community. Transparency also involves collaboration. That centers the community as the expert partner. Collaboration centers the community as the expert. Building sustainable engagement models. I've spoken with many communities in which they always will lead with people come in, they do the research, and then they leave. And that just breaks down every bit of trust that's been there. And we must be committed to have sustainable models and relationships. And centering collective priorities, working with communities, consulting with them to study challenges within their communities of greatest priority to them. What concerns them most? And are we meaningfully engaging communities in the design, in education, and in dissemination of results? I've served on some grant steering committees recently that have just been amazing. I've seen models where the community helps design the consent document itself, way before it ever reaches the IRB, but they're designing those models for the best community engagement. I've seen models in which the community co-constructs the priorities for the research with the scientist, as well as educating, they serve as educating partners with the scientists when the research is being conducted within their community. And most importantly, communication. How we say what we say, when we say it, is it clear? Are we tying back the benefits of science to the impact on people's everyday lives and those of their families and friends? People want to know, how does it impact me now? How is it benefiting me now? Or how could it benefit me? And so being very clear about our communication and understanding who's controlling our narratives. If we're not controlling the narratives about science, about animal research, about human research, someone else is. And we get to co-construct and control those narratives. You know, I talk to people all the time about, because of science, we have longer lifespans. We have a better quality of life, and we have better medicines. I don't know about you, but I have family members who are on long-term treatments. I have family members who've had cancer. I've had family members who've had end-stage renal failure and heart disease and so forth. And I don't say that to bring you down. I say that to let you know that when those things occur and we get through it, I always point them back to, because of science and the work that we're doing, your quality of care can be better. You're able to take these medications. You're able to be on dialysis treatments that are not only just prolonging your life, but they're helping your life. And it's really important to tie that back. It's helped us. But we must provide an openness to information with context. So we need to be clear about the benefits and the imperfections of science and have deeper discussions around that scientific process. And so I've been developing just this transparency framework. What could it look like? How deeper do we need to go? And it's around accountability, that clear, open communication, making sure that information is understandable and accessible, and contextualizing it. If we're speaking our language, meaning the language of science, out in the public discourse, we're not going to get anywhere. People get lost, right? And so we have to make sure that we contextualize results and data appropriately and in a meaningful, non-misleading way. There are some results that occur in science and research that we didn't intend to occur. And we need to be able to talk about those, but provide context for individuals. And so I'm going to spend my last few minutes with you, because I don't believe in taking up your whole hour. Spending my last few minutes with you, just sharing some stories of transparency and practice, some that we've heard at PRIM&R from our partners and communities. But first, I want you to think about this. What does true transparency look like? And where do gaps still exist? So let's spend a minute talking about that. What does transparency look like? What are some transparency practices that you may be employing right now that could benefit others in the room or on Zoom? And where do you see gaps? Okay.
She said sharing results.
Sharing results, absolutely. Sharing results.
I was just going to I was just going to say that you make sure you explain all the risks and benefits of a study with a participant to ensure they know what could go wrong as well as what could happen that's beneficial to them.
Yes. Do you all use the teach back method? I don't know if y'all are familiar with teach back. I used it as a study coordinator and when I was in the IRB office. And if you've not, I encourage you to look it up, but it works. It's a beautiful method that has been studied and is tried and true. But when you're having that conversation and be very transparent, don't gloss over it, be very clear, but also contextualizing it. Anyone else? What does transparency look like? With public engagement, right? How you are informing the public about the research being done here on this beautiful campus. And these buildings with people, or animals even, how are you explaining that to others? And where do gaps still exist? Yes.
I guess I'm speaking from tribal communities set point of view.
Yes.
I think having some sort of plan in regards to things that do happen good, but also when things don't happen the way you want it to, that have a backfire in the tribal communities and having a plan for that.
Mhm.
So I guess when I saw that, I was like, transparency on both sides, not assuming that your research is going to go how you want it, but just being prepared and what that would look like for talking with the community if it did go bad.
Yes. Thank you for sharing. Absolutely. Being prepared to have that conversation, right? Yes.
Sometimes on the consent document, the investigator isn't fully explaining what the alternatives, like what's the standard of care? And we as, IRB members may not have specialty in that field. And so, sometimes it takes a lot of research to figure out what should be, research on our part to figure out what should be explained to the participants. What would be the alternative, and so they can really weigh the risk benefits of this. Sometimes it's a new medication, so they don't really know there may not be a good alternative. Sometimes there is, and I don't think that's always fully explained.
That's a great point. I've seen conversations where they say the alternative is not to be in the study, and that's not enough. Absolutely not enough. Anyone else? This is great conversation. Yes.
Dialogue or questions and concerns when it comes to research.
The open dialogue without defensiveness, right? We're very passionate about what we do, right? But sometimes we need to just listen and honor lived experiences and honor questions and the interrogation of what we do and how we do it. Sometimes it's hard. However, I think that's where we have the most meaningful impact. And so I'm going to share 3 stories with you to conclude my time. And so they are different stories around what institutions and organizations are doing to increase transparency and to center trustworthiness in their work. Some are internal, meaning this is actually transparency within their own organization, and a couple are external, but all are having a great impact on trustworthiness in research. So my first example, and my disclaimer is that there's some universities I'm able to share who they are because I've been given permission, and there's some that I'm not. And so I'll let you know when I'm able to share them, but this one I can, and they want me to share it, the University of Michigan. This is an example of transparency and trustworthy practices within their research enterprise. And when I heard this from them and we spent some time walking through it, it completely resonated with me. And so at their institution, they realized that many of their internal stakeholders in areas of communications, finance, and government relations who regularly interacted with their IACUC office, but they not actually seen the animal research facility. How many of us can relate to that? At places where I've worked, I've been next door to the actual labs and had not been in there to see them, but had an expectation to see that background and significance in these IRB protocols, never understanding the correlation. And so I thought that this practice was really great. So without that firsthand experience, it was really hard to understand the scale, the care, and the rigor involved in their research and in their work. So they created a facility tour program. Before COVID, they said it was small, in-person tours. During COVID, they shifted the tours to keep engagement going. They shifted it to virtual engagements. After the pandemic, they expanded the program so that participants could invite colleagues from other departments. They were 2-hour sessions. They walked participants through the facilities, all of the spaces, the surgical suites when they were not being used. And they gave them that open dialogue, that forum to ask any question. And the feedback that they received, they shared that one person said, "This is so not what I was expecting to see." And they actually talked about a new marketing leader that they had that said that the tour was invaluable because it let her connect with the work outside of the moments of crisis. She was able to connect with the work and the people doing the work outside of those moments of crisis. This impact has been significant for them. Overall, they say the tours have deepened understanding, dispelled myths within their institution, and strengthened institutional trustworthiness and trust. So they took what began as an experiment and they turned it into a sustainable engagement model for transparency and support. I really like that one because oftentimes we have to start within and making sure that our stakeholders understand who we are and what we do. An external model of an organization that we'll call University B is another way that you can, or another example of transparency forward-facing in the public. This university is widely recognized as a national leader now in communicating openly with the public about the use of animals in research. A few years ago, its leadership decided that rather than waiting to respond to criticism, they would take the lead in explaining their work openly, proactively, and in plain language. This was especially important because University B was home to a national primate research center. And they recently experienced some activist campaigns on their campus with protests, event disruptions, and negative media attention. They realized that the best defense was openness. So their signature initiative is a public website, and it's devoted entirely to animal research. It includes news stories about discoveries, overviews of the animals studied, information about ethics, oversight, and care, and clear answers to frequently asked questions. Most notably, they went a step further, and almost, any other institution probably wouldn't do this, but they posted their USDA inspection reports along with context, with explanations to help the public understand the findings and the context. Their goal was to release the data, but to make that data meaningful. Overall, they've seen great results from this approach. Activism has remarkably decreased. In recent years, there's been no large-scale or sustained campaigns against the university. They recognize by giving the public direct access to information with context, they increase their credibility, they reduce misinformation, and they strengthen trust. But they were that trustworthy model. And my last example is one from a human research lens from my former university that I'm proud to say is continuing this work in community engagement in their IRB office, which is really cool, Augusta University. Their IRB office-led community engagement initiative focuses on empowering and educating a public that interacts with their healthcare system all the time. These consumers were often approached to participate in research when they were there for their healthcare visits, but didn't always understand the protections that were in place. And so the IRB office said they wanted to be that source of information on research in a neutral space. And they've done several different initiatives. Because of the population and where the university sits, they focused some of their efforts within certain populations, the African American population. They recently did a talk at a local museum of history called Looking Beyond Tuskegee. And so what they did was they centered the conversation on the hard conversations that need to be had. They created a safe and honest space where community members shared their perspectives. They asked difficult questions, and they talked directly with researchers and members of the IRB office about how ethics and accountability work. I was there to witness it, and it was a very powerful conversation. They were powerful. Sometimes they were intense, but many of the participants said it was the first time that they had ever spoken openly with scientists and researchers and ethics professionals about their concerns and about their issues. This has led them to have a more formal partnership with this museum where they'll be doing more community forums. They're doing health literacy workshops. The IRB office is doing health literacy workshops, research literacy workshops, and exhibits to make research both accessible and transparent. They also go to health fairs and they provide their information there as a neutral party. Additionally, because of where the university is situated, there's a lot of rural communities, and they're participating in a rural outreach with a local nursery. And the focus of that health fair or that rural outreach is to ensure that information is given to non-English speakers in their native language and communicated to them in their native language. And so they distributed translated materials. They explained IRB protections, and then they were able to connect with people. And finally, they're doing a lot of work there. They're continuing and convening a conversation on barriers to research protection. Once again, leaning into the hard conversations to build trust. And this revealed how community members simply don't know about research opportunities that they exist. The insight is now driving their community strategy, and they'll begin to do some more later this year. Actually, they're doing one on breaking barriers and breast cancer research. And so I wanted to share those with you as just models and examples of sometimes it's within your organization that you need to do some of the work, but oftentimes it is the public facing and the connection with the community. So as we conclude, I want you to begin to think around what is one change that your organization can make today to strengthen research trustworthiness. And that's all I have. Thank you.
Thank you so much, Dr. Tillman. That was a wonderful talk and incredibly timely right now. We have one question if you have.
Okay.
Somebody just wanted you to go through the transparency framework just one more time.
Okay.
If anybody has questions out there, we can hand them the microphone.
All right. There we go. I'll just put it up there and let you all see it. But this is not, this is something that I'm developing myself, not necessarily published yet, but it's really around that accountability, that understanding, and that contextualization that we need to begin considering. Oh, let me grab my notes. I want to make sure I get it right. But basically, support does not look solely like participating in a research study, right? Let me grab that so I'll say it correctly. It looks like partnering and providing that openness and that transparency. I'm going to read it just to make sure I get it right. Support doesn't necessarily mean immediately participating in a research study. It's developing a shared commitment to interrogating the facts in a manner that moves the discourse forward and doesn't contribute to misinformation. All right.
Great. Thank you so much.
Thank you.
So we have about 10 minutes before our next speaker, so we'll take just a quick break and be back at 9:15.